I'm Dr. Sundari Mase, Sonoma County's health officer. I'm here to share the latest updates on coronavirus in Sonoma County with you. As of yesterday, July 7th, we have 1,487 confirmed cases, 700 are active, and 773 have recovered. We do have 14 deaths. We are up 2 since we last spoke on Monday. These deaths occurred at skilled nursing facility and residential care facilities. And both persons were over age 65. As we know, COVID-19 can be much more deadly in this age group. We have now done over 55,000 coronavirus tests, and the rate of our positive cases is still less than 8%, which reflects an average over the past 7 days. However, our case rate is now 107.8 per 100,000. Given these metrics, I'd like to talk to you more about how we're doing with the metrics that the state of California is monitoring. You may have heard, as the state's COVID-19 cases are surging, that each county is being assessed by the state of California to determine if it'll be put on the monitoring list, which is then posted on the state's website for the public to track. Currently, Sonoma County is in conversation with the state regarding our concerning metrics, specifically the case rate, but there are some other metrics we'll talk about. The state's monitoring includes 3 key metrics. One is looking at disease transmission, and that's measured in 2 ways: the case rate itself over 100 per 100,000, or a case rate of over 25 per 100,000 and a testing positivity rate of over 8%. So we meet the metrics for the first part. That's a case rate of over 100 per 100,000. State's also looking at hospitalizations. An increase in hospitalizations of more than 10% is a trigger point. Lastly, they're looking at hospital capacity. We're having less than 20% of ICU beds available, or less than 25% of ventilators available is a threshold. While these metrics are primary, there are a number of other metrics that are considered in the decision to put a county on the monitoring list. These include, for example, clusters in skilled nursing facilities or residential care homes, elevated case levels for a population or ethnicity, and outbreaks in certain business sectors. Once on this monitoring list, the county is watched for 3 days. If the data continues to be above those thresholds, restrictions will be mandated. As of July 6th, the state has 23 counties that are on the monitoring list. According to our local data, Sonoma County is experiencing very high levels for some of these key indicators noted above, and has a number of contributing data red flags that we're monitoring on our website, including the outbreak in a skilled nursing facility and in one residential care home, as well as a disproportionate level of cases in our Latinx population that we've talked about. The state has been in contact with Sonoma County regarding metrics that are out of compliance, and we're in ongoing discussion with them to determine our next steps. At this time, the county is not officially on the state monitoring list, but has been flagged and is being assessed. We haven't met the metrics for 3 days straight per the state monitoring. After a county exceeds 3 days on the official monitoring list, the following are closed for at least 3 weeks: restaurants, wineries and tasting rooms, movie theaters, zoos, museums, and card rooms, specifically for indoor activities. Outdoor activities will be allowed, but indoor operations at those different business types will no longer be allowed to operate. Bars, clubs, breweries, and distilleries, whether operating indoors or outdoors, are not allowed unless they operate a restaurant on the licensed premises, in which case they will be allowed to operate outdoors only. Alcohol can only be served outside a meal, not alone. So we must all work together to slow the spread and limit the time we're under these new restrictions. The way we can do that is to remember to wear facial coverings when in public indoor spaces and outdoors when unable to maintain the physical distancing of 6 feet, frequently washing your hands, staying home when you're sick, and making sure that you're just following all the other mitigation measures that we've talked about. Today's community question deals with fire season and evacuations during COVID. As we move into fire season, we've been hearing many concerns about potential evacuations. In direct collaboration with the Sonoma County Sheriff, we would like to share information with you about potential fire evacuations. First, I'd like to clarify the difference between an evacuation order and an evacuation warning. An evacuation order means you need to leave immediately. Evacuation warning means you need to get ready to leave. If you have mobility issues, you should consider leaving if under an evacuation warning. We learned from the Kincaid fire that early evacuations save lives and property. Don't hesitate to evacuate due to COVID-19. Plans are being made for shelter spaces that allow for safe physical distancing. To be sure you're notified about any evacuation orders and warnings, please sign up for SoCo Alert and Nixle. For more information, please check www.readyforwildfire.org and or socoemergency.org. Stay safe, and we'll talk again soon.